All right, so this is the video for traction. I'm here with Gloria, who is a 75-year-old female. She likely has degenerative disc disorder of the lumbar spine, and this has resulted in some lumbar stenosis and some mild neurological radiation down into her butt. Extension exacerbates and flexion improves her symptoms. And so traction here would be indicated early on in her therapy to help relieve those neurological structures and to help to stretch the tight ligaments and muscles around her spine. So based on the case, this patient doesn't have any precautions, but some standard precautions would include any previous lumbar surgeries or instabilities, any issues with blood pressure or evidence of a fracture, any non-medical pain, so pain that doesn't respond to movement, osteoporosis, or if symptoms peripheralize with traction. Okay, so let's go ahead and get into this. So, hey Gloria, how are you doing?
Doing okay.
Okay, so what we're hoping to do today, based on your symptoms, is what seems to have happened in your low back as a result of this degenerative disc disorder is you have some compression of the nerves that come out the side of your spine, and that is what's causing some of the radiating symptoms down your back. And so one thing I might suggest we do is called traction. And that helps to create more space in between those facets in the vertebra and should help to relieve some of your symptoms. And also because you have some tightness in the paraspinal muscles around the spine, should help to stretch those out a little bit too and relieve some of your symptoms.
Okay.
Okay, so is it okay if we go ahead and proceed with that treatment?
Yeah, let's try it.
Okay. Now, before we get started, I just want to check to make sure that you're a good candidate for this, make sure that we have no contraindications. So do you have any history of issues with blood pressure?
No.
And what about any heart problems?
Nope.
Have you had any surgery on your low back or any lumbar fusions? No?
No.
Okay, excellent. Well, I'm going to go ahead and put these braces on you, and this is what we're going to use to hook you up to the machine here. So let's go ahead and get started. Oops.
You have the hard one. It's like,
I know.
try to show this.
Okay, so this is our table here with our braces here. So Gloria, I'm going to have you go ahead and lie down on the table here. And I'm going to have you position this so that this is right above your hip bones. And then the bottom of this top one should be right below your rib cage. There we go. That looks good. Okay, I'm going to have you hold this for now as I strap you in here. Okay, so this kind of goes over and across. Pull this tight. Clip this here. You can feel that this is right above his hip bones. Now this comes up and across. I'll put this into the machine here. Okay, and now for the chest. This one comes over and across. This, how does that feel?
Feels pretty snug.
Okay. Is it uncomfortable?
No, it's fine.
Okay, good. I'll clip this back here. All right, so you're all strapped in. And another thing I'm going to do, because her symptoms are relieved with a little bit of flexion, is Gloria, I'm going to have you press your hips up a bit. Okay. I'm just going to rest this pillow right there and put this bolster underneath your knees for you. Okay, you can go ahead and relax. So we have this set up here so that traction is going to maximally relieve her symptoms. All right, so the setup for the machine here, I have it set right now for 15 minutes, but we're actually going to go ahead and decrease that for 10 for her first visit. And we're going to start it on progressive so that it has a slow ramp up time in 3 different steps here. Same for the regressive steps. We're going to keep it intermittent because this should be helpful with the lumbar stenosis and with helping to provide separation of the facet joints. And so there's going to be a 45-second on time, a 15-second off time. The hold force will be 30 pounds to start, and we'll progress this over the next couple visits. And then in the off time is going to be 50% of the max, so that'll be about 15 pounds in those 15 seconds of relaxation time. Okay, and now we're ready to start. So I'm going to find this kill switch, and if you click this button at any time, can you go ahead and hold this again? If you hit this button at any time, it'll go ahead and stop the machine. Okay, so if you feel any discomfort or a spreading of your symptoms, I want you to go ahead and click that button. Okay. All right, I'm going to click start here, and you should feel the machine start to turn on. Do you feel that?
Not yet. I think it has to ramp up.
Okay. So it's at about 12 pounds right now.
Slowly getting there.
Are you comfortable?
Is this on lock?
Oh, and that's the first thing, is we need to unlock the table here so that it can slide in preparation for the traction.
Feel it.
All looking good. So what I want you to do is I want you to lay back onto this. Scoot down that way just a little bit.
Okay, we are now at 30 pounds and the time has started. So it'll be on for about 45 seconds and then have 15 seconds at 15 pounds or 50% of the max force. How does that feel, Gloria?
Feels better.
Good. Okay, so for the purposes of this video, we're only going to keep this on for about 30 seconds. So I'm going to have you go ahead and click that kill switch. And the machine should release. And it's now at 0 pounds. So I'll go ahead and relock the table here. Go. Unhook the machine. All right, I'm gonna have you hold this. All right, how do we feel?
I feel better.
Good.
I'm healed.
All right, so go ahead and undo the straps here. Check the skin, make sure everything is good, and that is essentially how you do traction for the lumbar spine.